This week we're following on from our topic last week on software and technology in health and safety and how this can be used as a tool to improve your provision. So we're going to be talking specifically about AI today. Now this is a topic, it's gained a lot of coverage in the media, a lot of news over the last couple of years, and it really is something that is here to stay, so we do need to address it and talk about it and see how we can use it to improve our provision and the services that we provide. So as I mentioned last week, there's a lot of software out there at the moment. Quite a lot of that has AI tools built into it. So for form design, hazard identification, that kind of thing. So a lot of it's built in, even though you might not know it's there. It's really useful for a few things. So in terms of hazard identification can be a really useful tool for that. So highlight things that you maybe didn't think about. It's a good double check and it can be really useful for that. The data analysis, it can be huge. So this can analyze mass amounts of data. If you're a large company, for example, got a lot of historic data, it can look through that, identify trends that maybe weren't quite apparent before. If you're using a spreadsheet or graphs, that kind of thing. And then also one thing I think it's really useful for is for monitoring employees and monitoring people. So it can be used, you can get devices people can wear. They can look at people's signs, vital signs, that kind of thing, the way they're working, and it can identify things like fatigue, tiredness, and these are normally the things that then lead into an accident occurring. So you can highlight those and you can take an action before that happens. So the golden rules for me with using AI, it's this positive tool that we can use and we want to be encouraging use of it, but we need to make sure we're doing it in the right way. So my first golden rule is always bear in mind the site-specific factors that are going to affect the decisions and the control measures that you put in place. AI doesn't know about those, so you're going to have to put those in yourself and make sure that they're allowed for. 2, it's the human element as well. So again, if you're working with your team and you're developing your own safety policies, procedures, safe systems work, you know your people, you know what they do, you know how they work. That needs to be factored in. We can't just let an AI come up with a full risk assessment, for example. It's not going to be appropriate and fit for use. So 3, just bearing in mind, we're going to use this as a tool. We can use it. It's not that different to referencing a textbook or an HSE guide. We need to make sure that is all we are doing with it. It's a tool, it's one thing we're using. And we need to, as safety professionals and as people that work in safety and employers, team leaders, we need to just use that to factor that in, but still make our decisions based on our own thoughts, our own experience. So we're going to continue with this theme on technology into the next week as well. So we look forward to talking to you about that. Same as always, any questions, queries, please get in touch with us and we'd love to hear from you.